Hello, everyone. Thank you for joining us again. Thank you for always tuning in and always listening to our videos. We've had Dr. Henry before. It's more or less a familiar face. We really appreciate you, Dr. Henry. Just as a reminder, Dr. Henry is a consultant, urologist, basically in his practice, like I said in previous videos, in multiple countries essentially, and he talked to us the other time about BPH, one of the issues that sort of are specific to men. But today he's going to be talking about something interesting, something that I also believe that all men want to talk about. In one of the previous videos I've made, I've talked about some of my experience when I was practicing in Nigeria. And I was saying how in my first job, men didn't used to seek, I didn't used to see male patients. But in this new job, I started seeing a lot more male patients because, there was a barrier. Men were not able to, there was this barrier in terms of a veil that I couldn't see the patient. It was like an online consultation and all that. And so a lot of men started showing up. And one of the things about that particular period was that many of my patients, like about 80% of the patients I saw, had a common issue, erectile dysfunction. And so I just believe this is a big issue for men. And I mean, the moment ahead what we're discussing, I'm sure you know, this is a big issue. And again, we have the experts to talk to us about erectile dysfunction today. I really hope that men can just learn from this particular video. Please be sure to pay attention, be sure to subscribe, and be sure to share, be sure to leave comments, ask questions, and I'm pretty sure Dr. Henry will be more than happy to answer. Thank you so much, Dr. Henry, for joining us today again.
Yeah, thank you.
Nice
to be here again.
Thank you so much. Yeah. All right, so we're going to get straight into our talk on erectile dysfunction. I think there are so many names that people, so many things that people describe as, erectile. Tell us, what's erectile dysfunction? What is it?
Okay. Once again, I'm Dr. Henry, consultant urologist. So today it's a very important topic because when Dr. Tosin mentioned to me, I just smiled because, yes, I'm sure a lot of like I will always say, this topic is not only for the men alone. So if you are even a woman that is listening and you have your partner, your spouse, wherever it is, that you need to share this video with or this, please do, because it will help. And when we get into the discussion, you would see the reason why I always involve partners, which is the women. Yes, I always involve the women in management of erectile dysfunction because the truth of the matter is you need the woman to be actively involved. You need for her to understand what is going on. You need for her to know how what you are doing is going to work, for it to work. Yeah. So what I see is, this is not a preamble. What I see is that a lot of men come to, first of all, a lot of men are ashamed to talk about this topic. They have the problem, they are suffering from it for years, but they are ashamed to talk about it. So even when they come to the hospital, they start telling you that doctor, there's one thing, they start running around issues. It takes the experienced mind to know that this person did not come to the hospital to tell stories. Yeah. Let us know exactly why they are here. Yeah. So when you now dig deeper before they can open up. So men, please, once again, we are advocating. You need to give these gifts to yourself, to open up, to talk to your doctor, let him know exactly what is going on. Even for your spouse, let them know what is going on. So, get into the topic immediately. Dr. Tosin has warned me about time. So I'm going to try to stick to time. So erectile dysfunction generally is the recurrent or consistent inability to maintain erection that is sufficient for a satisfactory sexual activity. I'll take it again. It is that over time, the man cannot maintain or sustain an erection to satisfy either his partner or even himself. So that is why, like I mentioned, I go back again, which is why you need the partner most times to be involved in this management, because it is the partner who has the grounds, in quotes, who complains that the man does not even have this erection, and when he has it, he's so weak and all that. So if any man repeatedly over time has this is what we call erectile dysfunction. And in terms of the impact, we are even seeing now that a lot of not older men like we used to know, right? That used to, if it happens in an older man, you say, oh, he's getting old. But now, even younger people are coming down with this. A lot of younger people, and then we'll get to talk about why this is so. You see men from the age of 28, 30, 35, and above, they are coming down with erectile dysfunction. So it's a common problem now. You can pick 10 men from the age of 30, and I can assure you about 3 or 4 of them is going to have this problem. The other ones might have it and not want to tell you because they want to form bragado, but you would definitely find that it's now a common issue.
Wow, thank you so much. Thank you so much for that definition. And I think you sort of touched on the next thing I was hoping to get into, in terms of what are the things. I mean, you've mentioned the fact that this is not just an issue for the elderly, even younger people. And I think this is why everybody should be listening. Every man should be listening, and not just the man, but also the woman in the lives of these men, the people surrounding these men. It's an important subject for us to be sort of participating in. I think the other thing I want us to talk about a bit is what are the things that sort of predispose people to erectile dysfunction? Are there risk factors? Are there predisposing factors? Why would anybody even have erectile dysfunction? Like you said, this is a very important subject, and people would like to know what are those things that might predispose them to erectile dysfunction.
Yes. Okay. Common risk factors now, and we'll talk about, like I mentioned, in people that are more elderly, which means men that are from the age of 50, 60 and above. Most of these men have comorbidities, like we mentioned, probably diabetes, hypertension, and stuff like that. So these are common comorbidities that can predispose them to having erectile dysfunction. Then we come to the younger age group. It's important to mention this. Most of the people that would even be listening to this will be people from the age of 30 or even 25 and above, and they are having this. Smoking is a very important one. Smoking is a very important risk factor to erectile dysfunction. Some people will even tell you that they don't smoke, but the people around them smoke. So they are involved in secondhand smoke and stuff like that. In your office, people are always smoking in an enclosed space, and you are there. You are, in the environment that you always find yourself in. This is a risk factor. Then the next is alcohol. And even on the smoking, let me mention again that some people are into smoking what we call shisha or whatever it is, and they feel that it's not secret and all that. So it doesn't matter and all that. No, it matters. Because I wouldn't want to go into the nitty-gritty. I will still discuss a little about the pathophysiology. But you should know that smoking reduces what we call the nitric oxide concentration in the penis. So whether it is coming from shisha, whether it's coming from cigarettes, whether it is coming from even marijuana or other illicit drugs that are being abused these days. It is one of the common risk factors to this. The next is alcohol. A lot of our young people engage in alcohol these days, and that's at the rate where, it is becoming alarming or concerning. They tell people can actually brag that they can take 5-6 bottles and not feel drunk or whatever it is. But as it goes down, it begins to cause some problem. One of them is this erectile dysfunction. So I usually tell and counsel these patients, this, for some of them, it becomes an addiction. So you can't immediately tell them to stop doing that. So you have to tell them to either see a doctor to tailor down on this. If not, you are not going to have any treatment option you are going to be given. It's just going to be pouring water into the basket. So these are some of the risk factors. Then there are some medications also that are also, like I've mentioned, if you are hypertensive and you are on some antihypertensive drugs, it can also, predispose to erectile dysfunction. We know this as doctors. So if a patient comes to me and he says he is hypertensive, he's on hypertensive drugs, I'm going to check the kind of drugs that he's on. And if one of those drugs are the ones that I suspect is causing this erectile dysfunction, then I'm going to liaise with his cardiologist. And we're going to either look for an alternative or see how we can modify these drugs that he's taking. So some other drugs, antipsychotics, antiandrogens, and all that can also cause this. The other one too, in elderly people, we mentioned in our previous video about benign prostate enlargement. It can also be a cause of erectile dysfunction. If, for example, the person is on medication or has had a surgery and all that. So these things in general are things that we as urologists see the patient and ascertain whether this patient has any risk factor that is causing this. Other minor ones, not very common in our environment, are men who are always probably having or have had any form of pelvic trauma or have engaged in cycling and all that, or have had pelvic surgeries in the past, so it could also predispose to erectile dysfunction also. So these are some of the risk factors that we have.
Thank you so much, Dr. Henry. It's a bit of it's so interesting that some people one of the ideas that sort of push people, make people drink, smoke, and all that is this, like we use the word braggadocio, like to feel big, feel like a man and all that. Well, I mean, that some of those things that we've heard, do damages to our health, including sexual health, which in itself, is, I guess we'll get to talk about that. But yeah, I guess the message to our listeners is, you need to cut down on that smoking. You need to cut down on, the alcohol intake, essentially. And so thank you so much, Dr. Henry, for speaking to that. Just also maybe looking at your patients, the people you have talked to in terms of people with erectile dysfunction. I'm pretty sure you've seen quite a number of these. Like you said, it's a common thing, and even in my own small general practice that I did for 2 years, I saw quite a huge number. So I can imagine how often you see patients like this. In your view, what are the sort of the effects of erectile dysfunction on men?
Sincerely, as a urologist, I told someone an adage in my place says that the palm wine tapper cannot finish saying everything he sees when he's on top of the palm wine. But for men, it's a lot. This is one aspect of men's life that make them feel like they are men. So when this aspect is not happening for them, or when this aspect is not as they expect they should, you begin to notice that, you know, the man starts becoming withdrawn, the man starts becoming, you know, not going into a shell. Sometimes they become more aggressive because they are actually deflecting attention, so to say. So they want to still assert that they are. So the man starts becoming unnecessarily aggressive because he still wants his spouse or whoever it is to still know that I'm the man, even though I'm not functioning in the bedroom, you know. So you see that it totally begins to affect the quality of life of this man, you know, and that's why I wonder why men find it difficult to present. Yes, I know it's something that is not palatable, so to say, but please, this is not a death sentence. It is something that when you come to your doctor, he is able to know what to do. And even as I would always say, the earlier you present, the better it is. The earlier we find probably what is the problem, and we're able to deal with what the problem is. So yes, it has a lot of effects on the mental health of men. Some of them go into depression. I've had a woman who had to open up to me that she's in a marriage and she has not had any sexual relations with her husband for more than 7 years. Wow. And I'm like, are you serious? She said yes. She wouldn't gain anything by lying to me, you know, and which I agree. So, you know, I said, so how have you been coping for 7 years? And she said, well, this is just what it is, you know, because from the initial time when they tried and it didn't get up, so the man doesn't even, the embarrassment. So that embarrassment, so the man doesn't even want anything. It has gotten to the point where they now have separate bedrooms so that anybody doesn't, you know. So yes, it can actually cause a lot of issues. So please, men, we are asking, spouses also, women, we are also asking, partners, whoever is listening here, please, most of the time, I take time to counsel my patients because, you know, I don't know whether there will be time for us to go into it. But I take time because I find out that even speaking about it, educating them about it, brings about a lot of changes, you know, and even results that they eventually see, because understanding the problem is more important, or very, very important, as just like looking for the solution also. So some of them do not understand why they are having what they are having. If it is someone who has maybe a lifestyle that is predisposing to this, he has diabetes, he doesn't even know. He has hypertension, he doesn't even know. Now I need to also mention that, and it has been proven from research and everything, erectile dysfunction is even a pointer to many problems that men have that they do not know until they come with the erectile dysfunction. So cardiovascular health is a very big indicator. Erectile dysfunction is a very big indicator to cardiovascular health. How do I mean? So you find men who eventually decide that they are going to come to see the doctor because of erectile dysfunction. And then you check his blood pressure and you're seeing that it's off the roof. A young man. So he never, anytime they ask him, are you hypertensive? Are you diabetic? He's going to say, no, he's not. I mean, I'm a young man. So the only thing that brought him to the hospital is because of the erectile dysfunction. And you are now discovering that these are the problem that he actually has. And we all know that the hypertension and diabetes is poses more danger to his life than erectile dysfunction. But in a way, just like someone mentioned the other day, maybe God has found out that this is very important, which is why he has made it tied to this comorbidity so that he can drag men to the hospital. But like we always say, please, men, it's always better to prevent than to cure. So please come to the hospital if you have anything like this. It might be that there is something bigger even behind, and then this erectile dysfunction is how it is presenting. You know, so when I, like the story I told, eventually when I was able to consult with the said man in the story, and everything, in a space of 4, 5, 6 months, he got better. And performance improved. The partner was involved in the management, and we saw a very good. So imagine what you had wasted 7, 8 years for, and there was actually a solution for it, but just because you couldn't show up.
Yeah, thank you so much, Dr. Henry. And I would also imagine that this sort of also has some how do I put it now, social sort of maybe family social sort of consequences, effects. I mean, for instance, like you've mentioned several times this during this video that the family, the spouse should be involved. I mean, I can just imagine the fact that erectile dysfunction also has, you know, effects on family relationships, basically.
Yes, it does.
And pretty sure,
yes. Yes, it does. I can't begin to tell many stories.
Yeah.
You know, I have people who, you know, just contact me. Oh, they heard I'm a urologist. This is what is happening and all that. And I really would give kudos to the women who actually venture out and eventually make that move, knowing that probably their man is not going to do that and all that, you know. So like I said, men and women are going to be watching this video. So whoever it's in their court, please reach out. Get to see, because socially, yes, it affects even families. Everybody becomes estranged, and it starts causing deep issues, even in marriage and all that. Yes, it does.
All right. Thank you so much, Dr. Henry. And then the other question I just want to take us back a little bit to talk about the predisposing factors. Just when you were talking about it, this was one of the things I sort of, you know, my PhD thesis was, I've said a couple of times, on sexual violence against men. And one of the things I found was that as sort of the consequences, the health consequences, a lot of these men talk about low libido, which is one thing, but a lot of them also talk about I hear a lot of them say, or I heard a lot of them say, even when they try to have sex, even when they try to have sex, they are not able to sustain erections. So, and basically because of the trauma that they have experienced. In your view, in your sort of expertise, would you think there is a connection between, or is there, can psychological stress or even physical stress, say stress from work and all that, can it predispose to erectile dysfunction?
Yes, absolutely. Okay, so now that you have mentioned, I'm still sticking to our time. I'm just going to run straight through the pathophysiology.
Okay.
And so that even our viewers can understand. And yes,
what's pathophysiology?
Okay, so
pathophysiology, but
basically, you know, physiology is just the normal function of something. Then the pathophysiology is the abnormal way that function is affected.
Okay, sorry, I needed to clarify that. Just
sorry.
I don't want our viewers looking for dictionaries.
Yes.
Yeah, please.
So it's important. So normal erection, you know, and I'm going to run through it so that when I now get to why, so you understand why, you understand normal erection, and I now understand why why the erection is not happening if it is not happening. Do you understand?
Yeah.
So for normal erection, you need some things to be in place. And when the person, so I guess I'm also going to be answering some other questions, because when you come to the doctor, you know, what he's going to ask you, he's going to ask you a lot of questions, take a history and know when did this start? How did this start? Was there any problem around that time and all that? So yes, there's a psychological part of it. There's an organic part of it. But let me still go back to where I was going to talk about, which is the physiology. That's the normal function of erection. So for erection to happen, really, or for a good erection to happen, you need 3 or sometimes 4 things to be in place to be sure that a good erection is going to happen. One is the vascular component to the penis. It has to be intact. 2 is the neurological component to the penis. It has to be intact. Then 3 is, sometimes the hormonal aspect of it, which we are going to talk about. Now, when erection is happening, like I said, I'm going to consider our time and be very fast. So the penis is just a tube that contains, some tissue. Now, this tissue or the penis, when there is no blood accumulated there, the penis is not erect. That tissue or let me call it sponge. The sponge is pressed or not containing anything. But when blood flows into that sponge and fills up everywhere, that is when erection begins to happen. So I wanted our viewers to understand this. This is basically how erection happens. So you need good blood flow into that spongy tissue for erection to happen. So if anything is affecting the vascular, that is the blood flow and the blood out of the penis, then there will be a problem. There's going to be a problem. So, and that's why we are bothered about hypertension and diabetes, because hypertension and diabetes can affect the blood flow into the penis.
Yeah.
Do you understand it now?
Yeah.
So, and that's why we always ask about this, So that's number one. Then the second one is the neurogenic component. That's the neurological component, which means for a man, usually there are stimuli to erection, which means what he sees. If a man sees something that stimulates him sexually, you understand? It goes from the brain and then goes through the spinal cord and then sends a signal, and then erection begins to happen. So you find out that in people who have stroke, for example, that have a neurological problem in their brain, or they have Parkinson's disease, that have neurological, so they have problem with erection because their neurological component is not intact. Also, in some people who have spinal cord injury, for example, they also can have problem with their erection also. So you need for the neurological component to be intact for you to have good erection, isn't it? Then the last part, which I mentioned, is the hormonal component to it. Yes, which means the man has to be producing enough testosterone to actually stimulate erection to happen. And we know that testosterone production as doctors is usually diurnal, which means it is produced usually twice in a day. One around 2 a.m. thereabouts in the morning, right? So even when he's asleep, even when the man is asleep, when testosterone is produced, it can stimulate erection, which is why most men normally should have what we call early morning erection or early morning mood. Do you understand?
Yeah.
So when he's asleep, he's not under any stress or under any pressure. The testosterone produced should be able to stimulate or give him that erection. So why is this important? It's important because when a patient comes to us and complains about erectile dysfunction, one of the questions we'll ask is he having early morning erection or not? Why this question is important is because if he says he's having early morning erection, then we know, oh, okay, it is not, he's having early morning erection. We say, oh, okay, fine. It means that everything that is supposed to be intact for him to have an erection is intact, especially when he's asleep. But probably when he's awake, he's not having that erection. So we might begin to think about a psychogenic problem or a psychological problem. Let me use it this way. And this is important because men come to me and I am always eager to rule out a psychological problem. Like you've asked, there are people that probably a change of job, a change of environment, a stressful project at work will trigger this psychological imbalance, and they will start having erectile dysfunction. It can even be a change of spouse. So probably the person he was with before, he was performing and he was okay, but now he's with someone new and he cannot perform. So there are so many things that can psychologically even cause this. So that's why sometimes we divide it into two. We say, oh, does he have organic erectile dysfunction or does he have psychogenic erectile dysfunction? So we try to dig deep and to know exactly why this problem is having. If he says he's not having any early morning erection at all, in fact, usually it's the woman we ask, oh, have you noticed your husband having any early morning? And he says he's not having. So we now know that, something is basically wrong with even probably the blood flow or with the neurological component and all that, such that even when he's asleep and testosterone is produced, still he cannot have an erection. So I needed to discuss this so that we understand that yes, there is a psychological component to it, and as when men come to us, which is why I said if the partner is there, we'll have to know, is there any stressful condition in the house? It might be, and you are, Dr. Tosin, you are a man just like me. When your pocket also is dry, I mean, the last thing you're thinking about is erection. So these are some of the things. So it might even be a financial problem. It might be so many things that is affecting the man that even at night when he's awake or when he wakes up, he's thinking about something. So you see that this is not the person that is going to have an erection if there are things that are, not allowing him to concentrate and all that. So it is so I needed to bring out that when a man comes to us with this, we now need to check, is it a psychological problem he's having or is it an organic problem he's having? This will also determine the kind of treatment we are going to offer this patient. Yes.
Thank you so much, Dr. Henry. And on a lighter note, I think it's probably then one of the reasons why people often say men just want peace of mind,
Yeah,
just give your mind peace of mind, basically.
Sincerely, that peace of mind is underrated.
Absolutely. And I also think also that men also have to ensure they give themselves peace of mind too. I mean, your health is important. Your sexual health is important. Your mental health is important. I know that we've talked about this a couple of times. I know that you need to make that money. You need to, but obviously, there should always be a way to chill, basically. Thank you so much, Dr. Henry. Just one last question, just on this subject before we begin and sort of call it a day. Just in terms of the management, when people have erectile dysfunctions, there are, so I don't want to be mentioning names of sort of things we've seen on social media and all that, people have said all sorts in terms of what to do. But so I want to just know, what do you advise people that have erectile dysfunction to do? But particularly, I want you to also talk about the place of herbal medications in terms of, because I think this is one of the things people generally sort of resort to. What are your thoughts?
Okay. Yeah. Yes. In fact, apart from the herbal medications, I've seen some formulations, I've seen supplements and stuff like that, which people come up with and all that. So I'm going to say, first of all, when men come to me with that, I even tell them they are compounding their problem, because some of these herbal medications will, first of all, they don't have dosages. That means sometimes they tell you sometimes they say open the or take one shot of the cap of the whatever it is in, and you drink one shot. That is not a dose. That is, it's not a specific dose, so to say. So some of these herbal medications, you don't even know what they contain. Some of them end up damaging the kidneys or damaging the liver, which are the two most important organs for excretion of drugs or any ingested material, you know. So furthermore, if the kidneys and the liver is damaged, it will furthermore cause the erectile dysfunction that you were trying to treat, you know, because this is also part of the risk factors also, you know. So I totally discourage the use of all these herbal medications. Some will tell you that, yes, they have noticed that they actually gave them the erection that they wanted. Some of them, like I've said, because they don't have dosages, if the person took one cup and it works, they would want to take like more. 4 or 5, so that, yes, more.
Feel more like a man.
And then they will present to us with what we call priapism, which means he has now had the erection, but the erection has refused to come down. Because, like we know, the everything in excess is actually a bad thing. Every good thing in excess is actually a bad thing. So he has so having priapism again is now another different topic to talk about, because if you have priapism and you refuse to come to the hospital, it will eventually lead you to having erectile dysfunction, probably for the rest of your life even. You know, so totally we discourage against this. We ask patients to stay away from these things. I give them normal, natural, sometimes natural remedies that they can take, and patients report that they have seen good results with this. There are fruits, there are snacks and all that a patient can engage in, and it has been actually certified that these things work because of what they contain. For example, watermelon, for example, contains citrulline. Citrulline will be converted to nitric oxide and all that, and will help with erection. So you see, these are natural. You cannot take too much of watermelon. I mean, it's basically water, isn't it? So you need water in your body, but it also contains some other things that will help with erection. So we normally, as urologists, will just give dietary modification and advice and tell you to move away from these things that you see on social media, which will cause more harm than good. Yes. Some people will even walk into the pharmacy or wherever it is, or chemist, and start asking for drugs like Viagra and all that. While these things can help with your with giving you erection temporarily, if there is an underlying cause, if there is actually something that is causing it, and you have not gone to the doctor to search that out or to know exactly what it is, you are just painting your toilet without washing the water system. So it's just an effort in futility, really. Yes.
Thank you so much. Thank you so much for this very educative one. And I think an important lesson is just like you said, you know, it's one thing to want to get immediate sort of performance. I want to, you know, be able to solve this, even with, like you said, Viagra and all that. But what are the consequences that it has on you going forward, or does it also make you overlook? And I'm just saying this to our audience. You want to take those herbal stuff to get immediate performance and all, and it looks like, you're the champion now. But what is it doing to your kidneys? And at this point, I think kidney issues are some of those. I mean, there's no health issues that anybody prays for, but kidney issues are one of those ones.
Of course, you want to run away from that. Even your enemy, you don't wish that your enemy has that.
Exactly. You know? Exactly. And to do like, I mean, the treatment is financially draining, but as I've sort of learned, you know, over time, is that the finance part of it is probably even a small part of the issues that people have to deal with, you know. So it's better to just stay away Thank you so much, Dr. Henry. Was there any final thoughts just before we wrap it up?
Well, like I've mentioned, what's important is for you to, if you have any of this, please do present to your doctor, come to the hospital or whichever healthcare facility you use, so that you'll remember, like we mentioned, which is something I think I should again chip in. We mentioned that erectile dysfunction might be a marker of something bigger happening. So if you are hiding away from this, it means that for something bigger in the background, it's a bigger problem. So it's important that men should take this, and women also who have partners who have this problem, please encourage them. There is a way you talk to your partner, and he sees the concern, he sees the care that you actually are concerned about him, and the person would want to go ahead or come forward with this problem. Like I've mentioned, I always want to involve the partners, because most times they are even the ones, men are always, they are absent-minded. So most times it's the partners that will ensure they take their medicines, their drugs and all that, and then we teach them some of the techniques and everything that helps with this. Is the partners that ensure that good compliance to medications and all this is important. So please, nothing to be ashamed about as a man. Please do present to the hospital if you have this problem. Thank you very much.
Nothing to be ashamed of as a man. Present if you have erectile dysfunction. Thank you so much, Dr. Henry, for your time today. As always, this is, like I said, it's been quite informative, and I'm sure our listeners have learned a lot. Thank you. We really cannot appreciate you enough, but we are super grateful. So guys, I believe we've also obviously all learned one or two things. Thank you so much for listening.
All right.
I'll see you again next time.